HIV/AIDS is one of the greatest public health challenges recorded in human history. Since the first cases were identified in 1981, more than 25 million people have died of AIDS, and nearly 39 million people were living with HIV at the end of 2005. HIV is infecting over 11,000 people every day. The leaders of the G8 made a groundbreaking commitment in 2005 to work with WHO and UNAIDS to develop and implement a package for HIV prevention, treatment, and care, with the aim of as close as possible to universal access to treatment by 2010. The UN member states ratified a political declaration at the 2006 high-level meeting on AIDS to expand the goal to include comprehensive prevention programs, treatment and care and support by 2010. HIV/AIDS is overwhelmingly a disease of the developing world. About 95% of the people with HIV live in developing countries. Nearly two-thirds of them are in sub-Saharan Africa, where adult HIV prevalence exceeds 30% in the worst affected countries. 39-year-old Charity Molenga is one of the increasing number of people living with HIV in developing countries with access to life-saving antiretroviral treatment. Charity was a nurse and now lives with her 4 children in the Zambian capital of Lusaka.
Here in Zambia, we are in the community where nearly each and every house has a problem. It's either they are infected or they are affected. Day in, day out, we have funerals, people dying with HIV. Initially, people were very frightened to talk about their status or that they are HIV positive, because before there was nothing that was being given to people. So since now ARVs are free in the district clinics, I think it is a very good initiative which the government has done. It is going to help a lot of people. Definitely they'll be helped.
Health services in many developing countries are too few and under-resourced. In some heavily affected countries in sub-Saharan Africa, people with HIV-related illnesses occupy more than 50% of the hospital beds, and health facilities are overwhelmed by demand. In Zambia, where more than 17% of the adults are living with HIV, the University Training Hospital in Lusaka is experiencing many challenges.
We don't have enough staffing. Even for doctors, we have, on average, you have 1 doctor who's seeing, like in this ward, you have 1 doctor seeing 36 patients or 2 doctors seeing 36 patients. And that's a lot of work because most of these HIV patients need time.
Many developing countries will require external assistance if universal access is to be achieved. WHO supports countries by articulating health policies and developing normative guidelines for their implementation. WHO also provides technical assistance to help countries build stronger health services.
The AIDS epidemic is one of the greatest public health challenges the world has ever faced. The international community has now set itself up for a very ambitious goal in terms of achieving universal access to prevention, treatment, care and support services. This kind of effort and response that will be necessary and that will come will have a huge impact not only for HIV/AIDS but also for other major health problems. WHO is working now very closely with national governments, with NGOs, with civil society, with private sector on the ground to provide technical support, guidelines, but also to ensure that the necessary drugs are there and that there are motivated and trained staff in health facilities.
WHO takes the lead in the United Nations system in the global health sector response, working with partners and national counterparts through its global headquarters in Geneva, 6 regional offices, and 144 country offices. WHO is governed by the World Health Assembly, a decision-making forum of health ministers of WHO's 192 member states.